SCM. So for grade 2, kaya makadus as a partial range of motion with contraction ay with contraction. Yeah. Ang grade 1 is walay motion, ay contraction, then grade 0 is walay.
For grade 3 guys, you just have to palpate a muscle here. And then the patient instruction is just let the patient look left or let the patient look right. So sir, can you look left? Left. Turn your head over. In the other side. And then for grades 4 or 5, I really want you to add your resistance on the temporal area of the patient. So, have the patient turn right, and then against. Here, so your hand is like this. So, what I want you to do is face your head back where it came from. And then grade 4 guy soft and grade 5 is not soft. For grade 3 guy, we want the sitting position. Same thing, just palpate your neck quad, your neck faders, scaling, colli. It's around here. In the neck area, so sir, just turn your head to the right. Grade 2 guy, opening the range of motion. Grade 1 guy, there's muscle contraction, and then grade 0, molecular contraction.
So for high jumping, so our muscles involved, our muscles are the muscles which includes the rectus superior, rectus inferior, rectus abdominis, rectus abdominis, superior oblique inferior. So we're going to test each eye separately by covering the eyes here, one to one eye, and then the other. Then after that, we're going to test both eyes together. So you're going to instruct the patient to look at his finger, and then follow ang finger without moving their head. Only their eyes ang move. So sige sir, I'm going to cover your eyes. So now we're going to test your right eye first. And I want you to follow my head, look at my finger, and I'm going to follow my face. So next we're going to test the other eye side. Sige, look at my finger and then follow me. So now we're going to test both eyes together. So di na natin i-cover ang iyong eye. Sige sir, I want you to look at my finger and then follow me. Okay, so for functional, okay, there's a complete full expression. Then for WF and weak functional or non-functional, okay, there's we're unable to distinguish between the requirement between the functional and the zero. Then for zero, okay, talking motion is answered.
Guys, trabaho sa mechanics for torticollis. Yeah. CM. Ang sa ang CM ana? Spastic or shorten? Ha? Shorten. And then, for your direction sa yung torticollis, what is that man?
Rotation.
Bigas ni barog dato. Ito katabangan. Demonstrate right torticollis. Kasi yun. Papatudlo nila sa direction.
Ito dito.
Yun yung patudlo nila.
Ito dito.
Pumasok ka sila. Sige, yun sa direction. Right torticollis. Oh. Sa.
Left. Yeah.
Ha? Unsa guys? Sige, unsa. So, sakto, SEM. Correct, ma-shorten ninyo yung SEM. Next, direction. Let's say, right torticollis. Kasi forma sa liog at sa bata. Unsa man. Inyong lateral flexion, contralateral or ipsilateral? Oh, ipsilateral. So, ipsilateral daw. Right. Lateral flexion. Ayun sa tuyo ka yung ulo. Lateral flexion sana. Then, inyong rotation. Oh, contralateral, Legaspi. So, that is your right torticollis. How do you stretch right torticollis?
Right, baliktad.
So, contralateral, lateral flexion, ipsilateral rotation. Gets? Sakto dali. Namdumi ha, torticollis ha. Inyong action kay, ang inyong lateral flexion kay, ipsilateral. Inyong rotation, contralateral. Inyong stretch, inyong lateral flexion for stretching. Contralateral rotation is lateral.
So, for a cover kay eye opening, easier rin siya pero dapat careful siya. So, ang imong buhato na kay light lang na. Ang imong thumb, imong index kay diri sa above sa eyelid, above sa lashes. And then, ang imong resistance ani kay downward. Ayaw i-press ang eyeballs kay so, yung resistance na kay downward and then dapat open your eyes. So, ang mga instructions sa patient kay ma'am, akong i-close yung eyes ay akong i-close yung ayaw paluping na. Ano na siya? So, if functional kay maka-open siya yung eyes and then ang weak functional kay partial lang. Ay, sa functional kay makita dyan yung iris and then sa weak functional kay partial lang and then for the non-functional kay hindi siya ma-open and then for zero kay ulit.
What's the muscle for eye opening?
Orbicularis.
Sure? 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 Elevator, palpebral brace, superioris. Inyohang duha na, duha. Other one. Guys, muscles for eye opening. Hoy, sa oy. So? Ikaw pa rin. Ha? So 80% is levator, palpebral superioris, and then 20% is your okay ko kabaloan niya ang tugupan ko. Sige, unsa? Banyo. Napatay. Unsa? Mahog. Torres. Mo. Unsa? Mueller's muscle, oy. 20%. Mueller's muscle. Mueller's. M-U-E-L-L-E-R. 80% na 80% is levator, palpebrae superioris. 20% is your Mueller's muscle. Sige, proceed.
So what you're observing is the depth of the washes is how it is outside of the eyes, and then you just compare it for a manual resistance, first most instructed patient he's supposed to have slightly and hold this position. Then you want to use your thumb and this urine, place it on the bottom of your eye, and then you're going to try to try open your eyes by spreading your fingers, but don't press on your eyes. Please hold this position. And then for the grading, they are considered functional if they can hold against resistance. For weak functional, they can't hold against resistance and the motion below the A. And then also have it exposure, where you can still see a little bit of lights in the eyes, but the iris is not visible. But for non-functional, the iris is still visible. And for zero, there's no sensitivity of the eyes.
What's the muscle for eye closing? Orbicularis oculi.
Okay guys, so the movement that we're going to be testing will be frowning. So the muscle that's included here is irrigator. So your patient will be short sitting lang, and then you just stand in front of the patient. You tell the patient, sir, please frown. Yeah, so you see what he did, use his mouth. You don't want that to happen because the irrigator is here. When you want him to frown, you ask him, sir, can you please scrunch your eyebrows like this? Yeah, so you see those lines, the wrinkles in your eyes, that's what you want. That's the irrigator especially like pushing it together. So sir, please frown. Okay, relax. Okay, so what you're gonna do is you have four criteria. You have functional, weak functional, non-functional, zero. So for functional, okay, sir, please frown. Then you're gonna provide resistance. You say, sir, please don't let me erase your frown. Erase. Then you put resistance. It's either with your thumb or your index finger. Slide your distance lang. You push like that. Small lang because the muscle isn't very strong. If they can take the resistance, then it's functional. If you can erase it, then it's being functional. If there's slight movement, so for example, I tell it to frown, wala run, then that's non-functional. Kunyari wala good, that's neuro. That's your problem.
What muscle again?
Irrigator superciliary.
What condition possibly you can use the MMT for the irrigator superciliary?
MMT kung mukod yun yung
What condition? What condition?
depression.
What condition?
Anxiety disorder.
Huh?
Dissolve.
Also may condition with Bell's. So common kay na siya for Bell's palsy no. If may Bell's na patient, tanan muscles of the face inyo itas. Mag-MMT mo sa tanan. So it's very important.
Okay, so next we're gonna do raising of eyebrows. So basically, the only muscle that is responsible for raising your eyebrows only your frontalis, and its fibers run from here for the left side, from here to here. Then the right side, from here to here. So the best is you need to let your patient raise their eyebrows until you can see the wrinkles, the horizontal lines here. So, sir, can you please raise your eyebrows? So, as you can see, if makita ninyo ang panikuan, kay mo na like inyong, here ang iyang frontalis, pero if push ninyo down, then like, murag gamay na lang inyo makita ka lines kay it means it's weak. Tapos if wala gyud dali mo makita, meaning wala ni contract iyang frontalis, wala siya erase yung eyebrow, so it's non-functional. And also the muscles responsible for the depression of the eyebrows is the corrugator superciliate and the oculi? Yes. Yes. Alright now. And zero is no eyebrow raising.
This one, right?
So, ang patient is short thinking and ang therapist starts with it. So, ang muscles involved in their case the Perseus, nasalis, and depressor septi. So, ang button is ang instruction mo sa patient, sir, imagine na ito pagkakali yung mata. When I go as a patient, what you will do is apply force laterally with your thumb or mana. Ang force ani is just enough to smoothen the crease of the bridge of the nose. So, ang breathing ani is functional, functional, non-functional, and zero.
Lagi tukuhan na rin.
Functional na ay prominent crease or there will tolerate ang patient with some resistance. Then, weak functional, shallow depression, or will wrinkles sa nose, muscles sa nose to any resistance. Then, non-functional, barely discernible motion sa face, and zero ay no change in expressions.
So, ang bottleneck is kay closure. So, closure talaga kaya siya basically ang rating gap niya ay functional, to zero. Functional kaya ang patient or resist of strong resistance. Weak kay weak ka ang iban. Yangan kay na-movement ang iyang lips pero kanang sila niya close then zero kay hindi niya makapagpalit ko sa iyang lips. So yung button kay ang patient start siya o kanang open mouth for kanang sanitary purposes magamit mo kanang tongue depressor. So kundi kung kanang mo pwede sa iyong kamuton. So basically ang iyong button kaya hindi niya iputang in between sa lips sa patient. Close niya yung mouth, close the mouth. Then ang iyong resistance kaya basically yung mura mo mag-i-force yung open ang lips sa patient. Kaya ka siya, di na ako ma-pull. So, kung ka na functional ang patient. Kung example, ingani ka na maado resistance siya. Kaya ma-move na ito. Weak functional. If ka na na-rin movement ang iyang lips, dili niya ma-close, kaya mana na ang part.
Dili kinalaw yung butang, miss.
Ha?
Kailangan functional to
Ha?
zero.
Asa na yung butang? Kaya wala yung pa ako.
Sikid.
Close.
Make sure nga ang lips ra ang sa lips ra gigamit. Wala labot ang ipon. Guys, doing that kay make sure ha nga dili ang ngipon ang nakapaak sa pang depressor, dapat ang lips good. Kay inyong gitas is for lip closure baya. Okay, basin dili mo makon nagtuo ka nga na resistance pero dito gipaak na dahil sa imong pasyente. So, make sure lang proper ang placement sa inyo pang depressor.
So, I will be doing empathy for kay masa ka kung sa sir ko ang ko kontra ang result sa mga pero sir kaya so you want to put the tongue depressor sa iyong cheeks sa inner cheeks. Sige sir, paano ito yung mga sir and then patient instruction is ito siyang ipa-suck in sa iyong cheek and then tell the patient na hindi mo madas resistance. So, and then sumora and then ang alternative ani kay you can use a latex glove and then use your index finger to apply resistance. So for the grading ani kay for magapon functional, weak functional, and non-functional of 0. So for functional is the patient can do the activity with strong resistance, and then weak functional kay the patient can do activity without resistance. And then non-functional is high muscle contraction, and then 0 is no movement.
Okay. Next.
Okay, so you will be testing for jaw opening or mandibular depression. So your patient should be sitting up since you'll be testing one the mandible. So this test is ought to ang patient kay mag-open siya siyang mouth as wide as he can, and then dapat kay makahold siya sa resistance like I did. So this hand, yung dominant hand kay mag-cup sa ilang chin like this, and then yung other hand kay mag-provide stabilization sa top sa iyang head. Yeah, ang tendency ko ba if you don't put stabilization sa top sa head kay push mo for the resistance kay mo extend ang iyang neck. So, ang resistance niya here, this stabilization, top sa head, ang resistance kay here sa top na hand, and then vertical upward, at ang close the mouth. So, ang patient instruction namin, ma'am, please put open the mouth as much as you can, and then hold it, and then don't let me push it up. So, here nakapag-apply yung resistance na taas. So if she can hold it for, I guess, like here, Anna. So if you think na one shot, like 35 to 40 mm, or makastop ka 3 to 4 millimeters, Anna. Kay that's functional. And then only 2 or fewer kay weak functional. If non-functional kay siguro siya na yung motion, and then hindi siya katawin ng resistance. And if 0 kay no motion at all. So then hindi siya maka-depress sa iyo here. And the muscle test here is your lateral pterygoid. So if you wish to palpate the lateral pterygoid, you use your hand, pero ka ng glove, finger, and then put mo siya sa mouth, and then point mo siya posterior sa
are your muscles for mastication? Time. T is for? I is for? M is for? E is for? So T, I, M is for your mouth closure or jaw closure. E is for your opening. Ano na kasi ninagduman ha? Gets? Thank you. Guys, by the way, what innervates the muscles for mastication? What nerve? Vagus? Ha? Unsa man? 3 branches. Unsay na 3 branches? Trigeminal. Trigeminal ha for muscles of mastication.
So, karon kay mag-lateral jaw deviation. Kasi ang muscles for lateral jaw deviation kay lateral, right? Very good. So, ang gradient is functional, weak functional, non-functional, and emotion. So, ang inyong buwan na ni lateral jaw deviation, we use mo pencil. So, ang inyong assess, aniha kay ang relationship between sa upper and lower incisor. So, please glance now. So, dapat nani middle, midline, ang inyong pencil, siyang nose. So, real ko, ana sa right, please, say mo mag-draw ana. So, ang normal ani, kani makita mo, ang midline, so mula pa siya 3 ka, ang midline sa lower, mula pa siya o 3 ka upper teeth. So, ang mohang stabilization na gina sa opposite temporal lobe, yung mohang resistance gina sa lower, using your palmar, sa imong fingers. Sige, ang mohang resistance sa niyang padong lateral, siya kay padong midline. Ana, sa right na, ana, ikaw, balik ko sulod. Okay, so, functional nito, if we mohang teeth, sige, balik, correct side. So, ana, tulog ka, upper teeth, or if weak functional na siya kay 1 upper tutra niya ha. So, minimal resistance na siya. So, 1 upper tutra ang muana sa inyong kaso. Then, non-functional kay minimum deviation, no resistance, no motion occurs for no motion. Alright.
Next.
Good morning, everyone. Today I'm going to be So the muscles being tested is assessed by your medial and lateral peripheries. And for this one, sitting a patient, we're referring to body mechanics wise maybe once much better if the patient will be sitting on the monochrome chair and you will be standing. If you can't siya, you have to do is apply mo. Anyways, label ang patient, then for stabilization, you put your arm, or sorry, your hand behind your neck. And then for patient instruction, that's the mouth, you please push your jaw forward. And then for applying resistance, you stabilize again with the back of your hand, like the back with your hand, and then you place the web space between your thumb and your index finger on your chin, and then your index and then your thumb will be on the side of your chin. So with this, can you push your jaw forward? So with this, initially, you have to assess the gap between the teeth. So for the grading of this, if you see that there is a discernible gap between the teeth, and you could apply strong force, then that would be functional. And then if you still apply force, however, there's not a lot of gap and there's no discernible gap, wala siya, makes functional. The non-functional, there is minimal motion, but there is no gap between. They don't also withstand resistance. And then for weight 0, no motion, no resistance. So for the resistance, it's like this. So sige, miss, you push your jaw forward. And then, sige, okay, miss, you hold that position, hold that
Wala na. Masusulatang na na. Pang na. Wait lang. Guys, review. What is your surprise muscle? Surprise muscle. Review muscles of the face. Review. Huh? No? 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 Listen. Oy. Damgo. Muscles of the face. What is your surprise muscle? Occipito frontalis. Your frowning muscle?
Corrugator supercilii.
Huh?
Frowning.
Frowning.
Yeah, corrugator supercilii.
Eye closing.
Auricularis oculi.
Eye opening. 80%.
Levator palmaris superioris.
20%.
Uterus muscle.
Sige. Expression of distaste. What muscles does? Unsa? Unsa to? Ha? No? No? Ana, unsa na? Unsa na nga muscle? No? Procerus. Next. Dilation of nostrils. Nasalis. Smiling muscle. Muscle for smiling. Hoy, unsa? Sumbong ta mo, Sir Luke, ha? Smiling muscle. Unsa inyong... No. Uso kayo mo, ngisi-ngisi mo kabaon sa muscle. Unsa? Smiling muscle. Zygomaticus major, oy! Next. Grimace. Muscle for grimace. Risorius. Kissing muscle. Oris. Guys, listen ha. Kissing muscle. Orbicularis oris. Blowing, sucking, and whistling. Buccinator. Pouting muscle. Unsa na? No? No? Pouting muscle. Mentalis. Pouting muscle. Eggad. Muscle for eggad. Patisma. Balik ka. Balik. Smiling muscle. Distaste. Procerus. Kissing muscle. Grimace. Eggad. Eye opening. Eye opening. 20%. Eye closing. Surprise. Occipito frontalis. Pouting muscle. Take note ha, kay inyong damgog yun. Sige, yun mo. Sige, last na, masusulutang. Kanara. Kanira sila. Maduha nila kanikadi with kanang indication with for functional as one and the same. Channeling. Wala. Wala. Sa libro wala. Kanara. Indicate lang ha.
Okay, ang functional, okay. Your faces will be your lips, so if lakas siya sa lips, that will be functional. Because over siya sa lips, then it will be functional. Right? Okay, it will be non-functional. And then zero if wala. For the next will be the tongue deviation. It will be like that. So you ask the patient to move the tongue to the right or left, and then your resistance will go against the movement niya. So open your mouth, out your resisting, and then put your tongue on the right. So for the reading, okay. So for the reading, okay, ang functional niya, okay, maabot siya sa cheek. For the weak functional, it will be at the corner of the mantra, and then the non-functional, okay, slightly left yun ng protrusion and deviation in the direction na action. Zero if not, ay like wala na siya. Next is for the retraction. For the retraction, you actually need a 3x4 gauze. Then you ask the patient to put your tongue out, and then you hold it. So I'll hold it back. And mga na ang resistance, you ask the patient to put the tongue back sa iyang mouth. So, functional siya, if mabalik niya yung tongue back, and then return yung balik sa iyang mouth. With like resistance, and then weak resistance, okay, it's like resistance trying to provide mabalik siya. And then non-resistance, ay non-functional, okay, no resistance niya. Further siya, but no resistance. And then zero information.
Ha? Inig cracks, bring lang mo o pang depressor lang.
So, wala,
Ngunit. Most likely. Ay, ganahan mo? Tang depressor lang dadaan katong tape measure. If na may retractable nga tape measure, mas maayo. Invest mo na retractable nga tape measure kay copy itong mag-sync roll gani.
This one is for posterior elevation of the tongue. The muscles of this is the styloglossus and odontoglossus. So we're going to need a tongue depressor again. Yeah. Hindi ko haton. Posterior elevation of the tongue. Sir, balik ko open sa inyo mouth. And then you're going to use the bottom teeth as a fulcrum to push the on the anterior one-third of the tongue downwards and back. So you open sir. Push the anterior one-third downward and back. So paanan sa si sir. So ang iyong button, yung i-up yung tongue to reach the palate. Okay. Okay. 1, 2, 3. Okay. So yung button na for functional addings kay the patient will the superior surface of the tongue reaches the hard palate and separates the oral cavity from the oral pharynx with considerable resistance. Then weak functional, like slight resistance, yeah. And then functional, the tongue reaches the hard palate but doesn't separate the oral cavity from the oral pharynx. Then zero in motion. Then next, we're going to be doing channeling sa tongue. So yung mga instructing the patient, sir, can you please make a tube with your mouth? So kani wala siya iwan sa to, wala siya criteria sa to. So it's usually if magagawa siya, out and then try to touch the fulcrum, which is the bridge between your nose and over here. So try to reach that.
Pantay ka, miss.
Ha?
Pantay.
Ganun mo na. Ganun mo.
Okay, so make sure to reach.
Iantay ni mo.
So, for functional, maka-reach siya sa fulcrum, the balance na tayo kanina. And then, for weak functional, kanang maka-protrude siya, and pero din siya ka-reach sa fulcrum. So, like, kung yan, doon ako yun. So,
Okay, done na. Any questions, clarifications regarding exam
Go, please.
props? Huh?
Say, madam.
Ha? Ha? Coverage? Love guide. Study your love guide. Kailangan mo? Love guide, ito itong na-discuss kanina.
Then you have a manifestation for the trunk, for the study of pronunciation,
For that, especially also with the capital and cervical and the trunk, I think most likely with the case ana kay mention na ang muscle group gani pareha sa inyong UE and LE ni MMT. May mention na muscle group para you guys can perform the MMT, and then if wala gani indicate what grade inyo i-perform, start with grade 3 unless mo correct inyong assigned faculty to do grade 2 or grade 5. Most likely si Ms. Mars man siguro ang magpainaan na dyan perform grade 2 or perform grade 5. So kana. But if wala gani, then perform lahos o grade 3. Kaya dapat mo start mo with grade 3. Kana ha. And then most likely, I think vulnerable i-indicate agad what muscle group per dili na libog. Ang inyong ana is makaibaw lang yun mo take the proper positioning, position of you, the therapist, ang position sa patient, asa mo stabilize the resistance and the grading. Okay? And? Yes. Side question, most likely na-arag hapon sa inyong lab guide, kinagan magpapamata na good, especially with the muscles. So na-arag diha. So maybe na-arag diha nag-circulate. Yes? Functional? Yeah, functional. Started functional lang unless mo-correct na sa dito assigned faculty. Depende rin ganun nila. Kaya mo ang master copy as is good unless ganahan makita ang assigned faculty yun sa ilang ganahan taang. Any questions? Yes?
For the eyes, we start with the good side. Sounds na sa bad side.
Laos na bad side. If normal assessment, example, in rehab setting, you start with good side yun. Para you will establish like a basis, tanan. But during practicals, parihara with RM, MFT, na if practicals gani, if indicate na gani unsay lateralities, ditso na mo kung unsay laterality ibutang sa case sa dili na mo mag doble-doble. Okay, and then for the materials, listen. For the materials, just bring tongue depressor and then tape measure. Ruler, if you can, tape measure, okay naman siya. Mas maayo if inyong tape measure is katong retractable, gani pwede mo maglusot. I think brother nara sa katong something love dito sa canteen. What else? Questions regarding exam practice pa? Wala na?
Don't go.
Stop ko? Pas-tas ang pas mo. Hindi mo po na practice sa inyo. Manok mo sa exam sa
sayang
inyo.
daw. Joker.
Seryoso?
O gabi ka Joker, sis.
Okay. Siya po kasi na, hindi na mo. Happy na yun. Malaki mo ito siya midterms. Isa pa. Questions. Ay, for the book cut, ganun ba sa libro? I'll send the book cut later. I'll post it na lang. What else? Wala na? Okay. Lines in front. Standards.